Alrighty, good evening or good afternoon, good morning, wherever you're tuning in from today. We're so happy to have you on another edition of our continuing education webinar series. This month we have this is our second part of a two-part Lipedema Awareness Month webinar series that we're doing proudly with in partnership with Lipedema Canada. And today, as we did yesterday, we're joined by Emma, who will be introduced in just a moment. Before we get there, though, we'll do a couple little housekeeping items. I know we already see some people in the chat here. Click on that chat button in your Zoom toolbar and let us know where you're tuning in from. I see Shadi here from Toronto. We got Emmanuel from Peterborough. That is fantastic. My name is Troy. I'm the Director of Operations for Nurses Specialized in Wound, Ostomy, and Continence Canada. I'm tuning in from Ottawa today here, and I'm joined by Bev, who is our President-elect for NSWAC. Before I pass it over to Bev, I'll just do a couple little housekeeping items. As I mentioned, we're going to be doing a Q&A portion at the end of today's webinar. So if you have any questions throughout the duration of the presentation, please click on the Q&A button in the Zoom toolbar. That'll allow us to keep them all organized, make sure it's easy to get to as many as we can. I know we had some great questions from yesterday too that we might be able to cover today as well. We're also recording today's presentation, and thank you for everyone who was able to make this time. We know that we had to adjust the time slightly. We knew that we had a very, very heavy programming week this week with Lipedema Awareness Month, and Lipedema Canada did some fantastic webinars today. So thank you for everyone who was able to adjust to today's time. For those who have to leave a little bit early, I know it's a little bit later for those on the East Coast, we are recording today's presentation, so be able to watch it back after the fact, and we will make sure that anyone who was registered will also get that same recording link. You're also going to be receiving a certificate of attendance today, so we should be able to get that in to your inboxes within the next day or two here, so before the end of the week. So do stay tuned for that. That'll include both the certificate and the webinar recording link. And finally, we just want to thank Lipedema Canada again for agreeing to put on such an important webinar series. We really, really appreciate it. And we hope you spend a good amount of time with us today, really engaging with the content, learning lots, and asking as many questions as you can. So without further ado, I'll pass it over to Bev to help with our introduction for Emma.
Thanks, Troy. As Troy mentioned, my name is Bev Smith. I am the President-elect for NSWAC Canada, and I am so grateful to have Emma here again tonight. We had such a great night last night. If you didn't join it last night, glad you're here tonight. And like Troy said, kudos to you in the East Coast. I see a bunch of people from Nova Scotia and Newfoundland, so thank you for joining us. I know it's late there, so I'm going to just introduce our guest speaker. We're very happy to have Emma Clooney. Emma is, I'm trying just to get my computer to work though. Hold on one sec. There we go. All right. Emma is a women's health nurse and the vice president of and co-founder of Lipedema Canada. She was diagnosed with lipedema in 2021. She became the first woman in Canada to receive public health care coverage for international lipedema surgery due to the lack of surgical care available in our country. Her personal journey sparked national advocacy, leading to the founding of Lipedema Canada in 2023. Emma works to bridge gaps in awareness, diagnoses, and treatment through clinician, sorry, I'm trying to read this and it's flipping around for me, clinician engagement. Why is it doing this to me, Troy?
That's okay. It might be in the chat if you want. Here, I can.
I think it is. I think it is, but it's all good. I'm trying to read it through. Yeah, I think I got it. We'll get through this. It's okay, guys. Where was I? Emma works to bridge the gaps between clinicians and engage health system partnerships and patient education, aiming to improve outcomes for those living with this unrecognized condition. And now I'm going to pass it on to Emma. Thank you so much, Emma. And the floor is all yours. Thank you so much.
Well, thank you, Beth. Sorry, I know it's late for reading bios, right?
I know.
Like, what hour of the day is it? Well, thank you guys so much. Thank you again to NSWAC for hosting Lipedema Canada during Lipedema Awareness Month so that we could cover these really important topics. I know that there's a lot of you who were here from last night. Thank you so much for coming back. The feedback has been phenomenal and positive, and it is enlightening to my nurse's heart to know that nurses as educators are still making impacts. So Why are you here? You want to know what the deal is, and I want to tell you. So, welcome to Lipedema Uncovered. This is 8 surprising truths about lipedema and why Canadians are still being left behind. So as Bev mentioned, I am a women's health nurse. I work specifically in obstetrics and gynecology, and this is one of the babies I delivered, and this is with permission from the family member. It's also a family member of mine. This baby is no longer a baby, much, much bigger now. I am one of the co-founders of Lipedema Canada. There are several of us. I am a lipedema advocate, an educator, and my intersection, of course, is that I am a lipedema patient, and that's what brought me here and to these realizations. So who is Lipedema Canada? Well, I added in some of our other members who were not available when we had our photo taken. So you'll see that on our left, I think it's my left, we have Raina, who is a nurse from BC, who is joining us new to the board. And then on the other end, we have Helen, who is joining us from Ontario as well. So Lipedema Canada, Lipedema Canada is the national not-for-profit charitable organization that advocates for lipedema, serving as the national body. We were established in 2023 by committed individuals who are also lipedema patients, and our mission is to open minds and change lives. So we're going to do the disclosure thing because nurses always disclose. Lipedema Canada is not a medical provider. As a registered nurse and volunteer with Lipedema Canada, I do not provide a medical diagnosis, including for lipedema. Within my scope of practice under the College of Registered Nurses of Manitoba, I am authorized to provide evidence-based education on health topics, such as the presentation tonight on lipedema barriers. The information presented in this webinar is intended for educational and informational purposes only. It is designed to support clinicians in their practice and to be applied at their discretion within their own scope of practice. And if you happen to be a member of the general public, this content is for information and interest only. It is not a substitute for professional medical assessment. If you suspect you have lipedema, please consult a qualified clinician. All right, what are we going to cover tonight? Well, we are going to look at some of the systemic and clinical barriers that are really affecting things like lipedema assessment and diagnosis and care in Canada. We're going to talk about weight bias and gender bias that's affecting lipedema patients. We're going to explain the importance of clinical education in reducing things like misdiagnosis and underdiagnosis. And we're going to summarize the major intersections that are impacting assessment and lipedema care. And they are numerous. So we are going to talk about advocating for improved patient access to care and educational resources. And we're going to talk about real things you can do, actionable steps that you can do to support equitable lipedema care. And we're going to reflect on the clinician's role in transforming awareness into action. Okay, so some consolidation for those of you who were here last night. This is your post-test. And for those of you just joining us, we're going to cover some very simple lipedema basics pretty fast because we did cover this in great detail yesterday. What is lipedema? It is a chronic condition characterized by an abnormal accumulation of fat in the lower bodies, particularly affecting the legs and sometimes the arms. It spares the hands and feet. And this condition results in a disproportionate body, sometimes called two-body syndrome. It can lead to significant physical discomfort and emotional distress. And lipedema is often misdiagnosed or mistaken for obesity or lymphedema. This leads to undertreatment. Lipedema review. All right, who gets lipedema? Who's affected by it? Well, it is our assigned female at birth population. If you were born assigned female at birth, you may be one of the patients who has lipedema. It is characterized by painful nodular fat. It leads to easy bruising, heavy, tired legs or arms, depending on where you're affected. That disproportionate fat is always bilateral, meaning both sides, and symmetrical, meaning effectively equal where it's on the limbs. And it's genetic. It runs in families. While that gene is not specifically identified as causal, it is known to be genetic, running on the X chromosome. The onset is at times of hormonal change, puberty, pregnancy, menopause. Sometimes the start of hormonal birth control. Other times triggers can be stress, trauma, surgeries. but most often puberty, pregnancy, menopause. Lipedema fat specifically is resistant to diet and exercise and bariatric measures. And lipedema presently does not have a cure, sadly. However, treatments are available to manage symptoms, and we're going to talk about them. So thanks to the great comments and questions from last night, I updated this slide for you to include some of the things we talked about to be more comprehensive. So conservative care, which basically means anything that is non-invasive and doesn't mean surgery. How do we manage lipedema? Well, from the patient perspective, we wear compression garments, usually class 2 flat knit custom made garments, but not always. It really depends on the size of the limb and the patient and their tolerance. Pneumatic compression pumps can be helpful. Dry brushing, which is, there's a little picture of a dry brush down there. It basically looks like an exfoliation technique, but it can help move lymphatic fluid because our lymphatics are very close to the skin, and that can help decrease pain. Vibration plates. I like to giggle because a lot of the members of Lipedema Canada, we keep our vibration plates below our desks, and in our meetings, everybody's screen is kind of vibrating, and it can be great for managing whether you're seated or standing. Rebounders or trampolines, and they're also great for lymphatics. When it comes to providers, what do providers do for lipedema for us? Well, providers, whether they be certified lymphedema therapist or lipedema therapist or lymphatic therapist, depending on what school you graduated from, they may provide things like bandaging, compression recommendations, manual lymphatic drainage massage. All of the things I've mentioned thus far, they don't specifically move fluid because lipedema is not about fluid. It's about pain and fat tissue. All of these things help reduce pain and symptoms. And everything we do in lipedema management is about symptom management. So our providers also help with mental health supports, a very high incidence of anxiety and depression in lipedema. And if you have a body that doesn't follow the rules, that can be really distressing. And often patients with lipedema have been medically gaslit or have trauma, and mental health supports are really important for us, both for isolation and for ongoing management. Providers can sometimes prescribe medications or supplements. What I mean by this specifically is there are some supplements that may be anti-inflammatory or some medications that might be anti-inflammatory. None of these medications manage lipedema specifically, and none of them are curative. When it comes to lifestyle, patients might be encouraged often to engage in an anti-inflammatory way of eating. Anti-inflammatory diets can include things like Mediterranean, keto, sometimes something called a rare adipose diet. All of these focus on low carbohydrates and low sugar. None of them should be engaged for the purposes of weight loss, as that is not a realistic outcome. However, cursory weight loss may occur if you have comorbid obesity, which sometimes happens with lipedema. These anti-inflammatory diets should never be restrictive. So making sure that the calories are high enough to sustain body mass is important so that they're sustainable. We're told constantly to manage our stress. And especially during Lipedema Awareness Month, I have no idea what they mean. But stress management, because stress obviously can cause more inflammation in the body, we're advised to keep it under control. And to stay active as much as we can within the confines of our impacted mobility. And of course, the best exercise that's recommended to us often is aquatherapy. Whether you're swimming or simply walking through the water, at the lowest end of the water, the compression in 4 feet of water can be as much as wearing compression garments, and that goes up gradually. So simply, even if you don't swim, walking back and forth in water for 30 minutes can be very effective for a lipedema patient. Moving on. There is also surgery for lipedema. It is a specialized type of surgery, referred to often as lipedema reduction surgery, or for our purposes, LRS. This is a very specialized form of liposuction. Not at all cosmetic liposuction, and we're going to get into that in a fair bit of detail. It's important to know that surgical treatment for lipedema is not a one and done. It does require often, depending on the size of your body, multiple treatments. In some cases, the average is 3 to 4. That seems to be sort of the average across the large group. But as we know about averages, there are outliers. Some patients have upwards of 10 surgeries, and some may only have 1 or 2. Lipedema reduction surgery must only be performed by experts. Safety is very important. We're going to talk about that. All right, you ready? We've covered what is lipedema. Let's get into it. Why is it so hard? to access care for lipedema in Canada? Well, as Bev mentioned, in 2021, after suspecting that I had lipedema, I sought diagnosis. I sought care, I sought treatment and coverage for mobility-saving surgeries to be covered by the provincial healthcare system. And I will tell you that at the time I suspected I had lipedema, I had never heard of it. I had been working in women's health for quite a number of years. I was a relatively recent grad within the past 10 years at that point, and I was shocked that a condition that affected so many people was unknown to me. So it got me asking. When I applied to have my surgeries covered and I tried to find clinicians anywhere in Canada, I was willing to get on a plane and go anywhere. Somebody had to be able to help me. I found barrier after barrier, and this led me and thousands of others like me to ask the question, why is it so hard to access care for lipedema in Canada? Well, that brings us to the 8 surprising truths. All right. Now, this section, this lecture may elicit in you what I like to call passionate rage. You might learn some things here that make you feel really frustrated. But I also want you to know that at the end of this, there are also things we can do because none of us is ever really truly powerless. We just may not know the path yet that we're supposed to take in order to make change. That's how I got here. And I hope that when you leave here, you'll have some ideas of what you can do in your life to start making an impact right now, because we are not powerless. All right. First surprising truth. Lipedema is not a rare disease. It affects 1 in 9 people assigned female at birth. That's not rare at all. That is the same prevalence as breast cancer. Yet I've never seen a pink ribbon campaign or any sort of government-issued public health information about lipedema. But we're talking about an estimated 11% of the assigned female at birth population that might have lipedema. And I did the numbers based on Stats Canada most recent stats. And that gives us an estimated 2.2 million Canadian women assigned female at birth who might have lipedema, who are either carrying the genetics for it right now and it's not yet expressed, who are living with it, don't know they have it, who have it and know they have it, or who never got to know that they had it, or might be at the end stage of life where there's not really going to be a chance. Okay, lipedema is way more than fat. And we touched on this a little last night. We're going to go into depth a bit more. When you think about connective tissue, okay, you're probably wondering, well, what is connective tissue? Connective tissue is everything in your body. It is what supports and surrounds nearly every single part of your body. As the list below shows you, it's your skin, your fat tissue, which of course I've put a red flag next to, your bones, your cartilage, tendons, ligaments, blood, lymph, fascia, organ linings, joint capsules, blood vessel walls. It's quite literally every part of you. And lipedema affects the fat. And therefore, even though lipedema is classified as a fat disorder, it's also classified as a connective tissue disorder. And lipedema is comorbid with a lot of things. And now that we've looked at that list of connective tissues, you might go, well, some of these things might be related. So there is a high incidence, 50%, estimated 50% of our population will have hypermobile Ehlers-Danlos or hypermobile spectrum disorder. Those conditions are often paired with things like dysautonomia or POTS, which is postural orthostatic tachycardia. For those of you who don't know what that means or feels like, for a lipedema patient who has POTS, it might mean that when you move suddenly, you feel very faint, or your heart flutters, or the room spins a little. Doesn't necessarily mean you always have to pass out, but that feeling that you feel unsteady when something happens suddenly, or you don't drink enough water, or maybe you didn't wear your compression, that might be that, but I'm not your doctor. Mast cell activation syndrome and allergies can go hand in hand when it comes to lipedema. Mast cells, obviously, it's a very complex diagnosis, but it is also comorbid with Ehlers-Danlos, and it can lead to really wild allergic reactions. Bodies that simply don't follow the rules may not respond to anesthetic drugs the same way as other people. This is a really important consideration when we think about if we know a patient has lipedema, but we don't know what else they have. And now we're thinking about where should we treat this patient? What if this patient wants to go for surgery? What if they want to start a medication? There might be a lot of things we don't know. And if you're a clinician, a prescriber, or doing treatment that can be invasive, these are things I want you to consider. You should consider for your practice is what might be connected. All right. Migraines, hypothyroidism, gut issues. Well, that's connective tissue again. Depression, okay, anxiety as well. PCOS and different types of insulin resistance. But to be very clear, I want you to look at this list down here. Diabetes is right at the bottom. And that's not to say that there isn't some type 2 diabetes or even type 1, but it is incredibly low rates in the lipedema population. Some of that is supposed to be based on where the fat is actually carried. So for those of you who are clinicians, you'll know that the more obesity tissue that you carry in the midsection, the more likely it is that you might have insulin resistance. But when we look at the fat disposition of a lipedema patient being affected in their limbs, there seems to be in the research some protective mechanism to this fat. It's very curious. Sleep disorders are common. High blood pressure is also common, but that might be that it's painful when you take their blood pressures, and we can't really know if we're getting accurate readings. Something to ponder. Arthritis can also be common. All right, so you're looking at this picture, and I would ask you, do you see a forest or do you see trees? And if you're not sure, and I can't open the comments without getting distracted, a lot of people will say, well, I see trees. Those look like trees. And clinicians might see it the same way. Did you know that for each doctor's appointment that you are allotted in Canada, the physician is paid for approximately 15 minutes? They're supposed to get your appointment one and done in approximately 15 minutes. This means that they're limited to one health issue per visit, or they try to be. Well, based on that list we just went through, a lipedema patient may not be a straightforward patient. They might be quite complex. They might have issues with their gut and anxiety and migraines and a whole host of things. So if you come to your doctor and you say, well, I have this one health problem. So today we're going to talk about, let's see, I have high blood pressure. Okay, we might put you on medication for that. If you say, I think I need to have my veins checked, then they send you on another referral pathway. And for every other issue that you might come with, whether it's gut issues or an endocrine question or whatever, you go to a different specialist, you're referred forward. And none of those specialists, unless they are really, really good at standing back and saying forest and trees, they might completely miss that all of these things are interconnected. If you have issues with a lot of systems in your body, you very likely have a connective tissue issue. So those referrals go, they might miss that scope for us. And then we have to ask ourselves, have we missed the forest, the connective tissue, for the tree, the issue, singular? For many, getting a lipedema diagnosis is quite literally the tip of the iceberg. And I say this to you because I felt like when I got diagnosed at 37, I thought, okay, that's enough. I don't want to learn anything new or exciting about what horrors my body has to offer. Lipedema felt like enough. But as it turned out, my lipedema diagnosis lateraled into a hypermobile Ehlers-Danlos diagnosis, lateraled into a POTS diagnosis, and then into a confirmed mast cell diagnosis. And I said, stop, that's enough, no more. And then I found out that I also have ADHD. And how I didn't peg that the first time, I don't know. But I missed it in myself, I missed it in my kids. There's actually an excellent study that shows us that there is a positive correlation between lipedema and ADHD, that patients with lipedema symptoms are more likely to have it. Okay, think about that as a clinician. Are you seeing people who have similar body types, who have the same type of really intense personalities? Maybe they seem really anxious. Maybe they are struggling with executive dysfunction. They might be one of the lipedema patients that has ADHD. And when we look at this as a whole scope, we have to understand that the rates of anxiety and depression, sometimes in undiagnosed or unmanaged ADHD, well, that's quite prevalent. So this is just a good to know. But for me, this was the most recent earth shatter. Okay, prepare your passionate rage. It's not taught. What do I mean? In Canadian medical schools, despite being known as a condition since 1940, 1940, think about how much research could have been done since 1940. Lipedema is not a standard inclusion in the curricula or examinations in Canadian medical schools, nursing schools, or physiotherapy schools. It's not a standard inclusion. There might be mentions of it from time to time, but it is not part of the testing or examinations. That's a huge barrier. That means that all the clinicians you might be thinking of referring to, if you have now assessed, oh my, that patient might have lipedema, there might be an enormous, cavernous knowledge gap. Why? Why is this the case? Well, we talked about that lipedema affects those assigned female at birth. And the source cited below, Behringer tells us that there is very clear evidence that there is systemic bias towards underrepresentation in research and education for conditions that affect those assigned female at birth in women's health. We just don't study women's health the way we ought to. Women are not represented well in studies. And so you imagine all the intersections of bias that occur. Lipedema patients might look like they're obese. Well, that's a weight bias. And if you are an obese woman, that's an even further bias. And so we hear often from clinicians who even suspect that a patient might have lipedema, they're kind of disinterested. They're like, well, what are we going to do about it? That is a terrible answer. That is an unacceptable answer, and we endeavor to do better. What are the challenges to patients from the fact that this isn't taught in a Canadian medical school? Generally, it is very difficult to find a provider for your lipedema care. If you are lucky enough to have a clinician who is open-minded and you talk to them about lipedema, you bring in a brochure and they're willing to work with you, that's sometimes our best case scenario. In worst case scenarios, patients might be flat out told they don't have lipedema. They might be gaslit and simply told to exercise more or eat less, even if no questions were ever asked about how much you eat or how much you exercise. And then there's this middle ground, which can be equally as frustrating, which is where your clinician might acknowledge that you probably do have lipedema. They might even have received collateral information from maybe a certified lymphedema therapist that says this patient definitely has lipedema. But maybe they're just not comfortable giving that diagnosis and they don't know what the implications are. So you have a doctor who's okay with the fact that you might have lipedema, but won't give you any paperwork that says that you do. There is an issue with misdiagnosis. Patients, like I said, could be misdiagnosed for obesity or lymphedema or some variety or cornucopia of other things. We question whether or not, because of the pain related to lipedema, if some of our fibromyalgia patients might have been inaccurately diagnosed. It's difficult to know, but it's worth pondering. There's the potential for harm from things like restrictive dieting or receiving advice that isn't specifically good for a lipedema patient. If a clinician simply doesn't know what they don't know, they can't do better. This impacts patient care dangerously. A late or missed diagnosis. So late diagnosis is pretty common. The average age of diagnosis is somewhere between 35 and 40. Those numbers are changing all the time with the fact that lipedema is gaining knowledge and prevalence. But the missed diagnosis is a sad component. One thing I want you to know is that patients with lipedema are metabolically healthy most of the time, which means that they're not likely going to die of diseases that are specifically related to obesity. They're going to live a long time in a body that doesn't serve them. And we hear often about, well, I think maybe grandma had that and she passed away and never knew. The potential for a misdiagnosis is there. And sometimes patients advance beyond where care is available. They simply have disease progression to the point where they are quite literally beyond the most accessible help. And that can be devastating. All of these issues impact a patient's quality of life. Unmanaged pain and disease progression and a loss of mobility. These are all major factors for lipedema. And these issues, disease progression, pain, and a loss of mobility, they can happen in any body size. You do not need to have gotten to the largest body size that we showed in pictures for this to be the case. Pain does not discriminate based on your stage or size. Your mental health. Do you know how distressing it can be to be told your whole life, every interaction you have with a healthcare provider, or many interactions, I should say, you're told, have you tried eating less and moving more? Have you tried this medication, maybe? Have you, whatever the thing, can you step on the scale? Do you know your BMI is too high? From a mental health perspective, knowing that there is something wrong with your body. And I'm telling you, we know. We don't necessarily know its name, but you know that something doesn't make sense. If all of the advice you are given about how you're supposed to just do these things and then your body's supposed to change and it doesn't work, the only place you can go from there is accepting it as a moral failing. Lipedema is not a moral failing. It is your genetics, and you cannot change your genetics. And it would be lovely if our clinicians knew that. Your financial health can be deeply, deeply affected by having lipedema. There's a couple of ways. A lot of our lipedema patients will leave the workforce early due to disability. I want you to think about professions where many of them are women or those assigned female at birth. Nursing, teaching. These are traditionally female-held roles. Think about how many patients or lipedema patients might be leaving these areas where we really need qualified people. Nurses, come on, you guys. There's so many of us. So the cost of leaving for disability is a financial hit, right? Obviously, disability care, depending on what you do for a living, may not be very good. You might end up on Canadian disability, which is barely sustainable. And then the treatment costs. Your compression, your MLD, if you're going to eat special food, if you're going to buy rebounders and vibration plates, and you are going to need multiple pairs of compression every year. And sometimes, based on our national survey, compression ranges in price between about $415 and upwards of $1,000 a pair, depending on which province you are in. That is an enormous barrier. What if you're one of these people on disability with no benefits? Nothing is covered by the province. How do you afford care? This leads to massive frustration with systemic failures. Patients are just mad. We're so frustrated. And that frustration can be palpable when interacting with clinicians. I want you to always, when you're engaging with a patient who might actually be medically traumatized from this experience of just living with lipedema, please proceed with empathy and know that maybe what you are receiving is not actually directed at you and might be able to be diffused by you. Okay. It's hard for patients, but you know what? It is also hard for clinicians. We have a lot of empathy for how hard this would be. As a provider, if this was never taught in your school, how are you supposed to know what to do? So let's say you figure out, okay, I think this patient has lipedema. I went to the webinar for Lipedema Canada. I figured out how to assess, and I feel more comfortable saying, I think that patient has lipedema. Now you want to refer onward. What do? It's completely unclear. It's not clear whether there's you're supposed to go to endocrine and then to plastics, or do you send them to OBGYN or obesity medicine, or what do? It's completely unclear. So often this can be a huge barrier for clinicians. They just feel paralyzed by not knowing what to do next. And we've heard from clinicians that sometimes they have withheld the knowledge that a patient has lipedema because they just felt it was hopeless to tell them. Clinicians may also lack the skills for diagnosis, whether it's that they've heard of it generally, but they haven't been formally trained, that missing component of being taught something in school. It can be hard. Sometimes we call it the old dog learning new tricks. I feel like an old dog in my profession already because things are already changing. They change in medicine all the time. But if I didn't learn about it in school, sometimes I might be more questioning of it. Is that real? When did that happen? What is the literature around it? That feeling is common amongst clinicians, and clinicians may be lacking the information completely, or they may know just enough, but not enough to feel confident in making a lipedema diagnosis. This is a problem. So, like I said, clinicians don't know what they don't know, and they are always doing their best to make good recommendations based on the evidence available at the time. But if you don't know that a patient has lipedema and you're making recommendations about potentially restrictive eating or activities they should engage in, even exercise programs potentially. If you have a hypermobile patient, different considerations are needed. Certain medications might be causing weight gain. They might be contraindicated for lipedema. But if you don't know what you don't know, then you don't do better. Complex patients whose bodies do not follow the rules. Now, I will tell you whether it's a product of my ADHD or my personality, which is also a product of my ADHD, I can be a fairly intense patient. And a lot of us are very intense. We can be complex because you'll run our blood work and it might be totally normal. You will put us on prescribed weight loss efforts and nothing will happen. And after we go through these processes where our bodies just do not follow the rules, clinicians get frustrated too. And it can be really hard to manage a complex patient who comes in with a lot of issues and you only have that 15 minutes. This is not a failing on clinicians' parts. This is just a reality of that the system is not built for complex patients. There can be deep frustration over what's sometimes referred to as Dr. Google. Dealing with frustrated patients, that sort of frustrated systemic failure anxiety that comes forward. But when lipedema is not taught in a Canadian medical school, then how do patients find out they have it? Well, eventually they either happen upon a picture. A lot of us will tell you we accidentally Googled something and pictures of what looked like our legs showed up. It can be really shocking. It was for me. Well, if you find out that you might have a condition from the internet, whether it's social media, TikTok, you came across Lipedema Canada's Facebook or some other creator, and then you go to your doctor and you say, hey, so I saw this condition on the internet. Walls. Not always, but often. We need to understand that it is not okay to discredit the fact that a patient may have recognized similarities in someone else in themselves and comes in with questions. And we as clinicians need to be open to the possibility that you may not know about every disease. In fact, you shouldn't. And none of us should ever know everything. And if you're talking about a condition where you might be a general practitioner, that means you're supposed to know a lot of things about a lot of things. Maybe you don't know about this. Please be open-minded. Those open minds do change lives. There's also a frustrating lack of support from the provinces for coverage and or for medications. Now, I've mentioned the medications. So GLP-1 medications are a very hot topic in the lipedema community. They are a hot topic because obviously they're quite popular for the fact that they're very effective at helping with a lot of conditions and a lot of issues. What we see in the lipedema population, although it has not yet been studied, is that being on GLP-1 medications can help manage comorbid obesity. That was expected, but it can really help with symptom management. The reduction in inflammation can really reduce pain. It can also act as a way to sort of halt where lipedema is. It cannot turn back the clock on lipedema fat specifically, but there's a lot of lipedema providers who are looking into what is the potential for this population. So why do I mention this in context of the provinces? Well, as you know, in Canada, it's very hard to get approved for a GLP-1 medication. Anyway, for those of you who don't know, GLP-1s are things like semaglutide, tirzepatide, also known as Ozempic, Mounjaro, Wegovy, Zepbound. They're all the same, GLP-1s. The provinces only cover this at this time for patients who are diabetic. And if you get on a GLP-1 to manage your lipedema symptoms, you may never become diabetic. But those medications can cost upwards of $500 a month. And if you come off of them, you will go back to being in pain, potentially. That is a big cost. Back to the financials. There's also no way to formally document a diagnosis of lipedema. We are going to talk about that in depth in slides to come. But that can be really frustrating for clinicians to have an answer to say, I know what this patient has, and have no real formal way to write it down or make it a part of the patient's chart. And that leads to clinicians also having frustration with systemic failures. Okay, what can you do? Well, here we go. What are we doing? Lipedema Canada is working to reach out to all of the Canadian medical schools in Canada to discuss the inclusion of lipedema in the course curriculum and examinations for doctors, nurses, and others. We cannot do that alone. That is an enormous task. And we are a small team of volunteers who are working very, very hard, including bringing nurses to the team who can help along with this. We can't do this alone. So how can you help? You can write a letter and reach out to the local medical schools in your area, whether that's a medical school, a nursing school, physiotherapy school, or whatever other profession you have come from. Write a letter and advocate that you think that some lipedema education should be included in the curriculum. Very often, people are open to learning. They just don't know what they're missing. And so we rely on help from you to make that happen. Okay, go to your appointments, patients, go to your appointments prepared. Bring Lipedema Canada brochures. You can sign up for them online. They are on our website. We will mail them to you. If you have an appointment today or tomorrow, you can download them. They're available in both official languages. We also encourage you to bring international standards of care to the appointments to support conversations about lipedema. If I'm a clinician and I don't know anything about the condition you're talking about, I might think you said lymphedema and then offer you different health advice, or convince you that you said lymphedema and frustrate you and start into one of those frustrated moments we talked about. But it can be really helpful. We've heard from clinicians that when patients bring information about the condition that they think they have, if the clinician doesn't truly know much about it, then at least you've handed them a piece, a resource, something they can look at, scholarly articles, which are from trusted sources, which say to them, okay, I can trust this information. Let me look into this further. So go prepared. If you're a clinician, order Lipedema Canada brochures and put them in your office, because they are like a symbol, a beacon that tells a patient walking in the door that you are a safe space, willing and open to discussing lipedema. It doesn't mean you have to be an expert in lipedema, but it means you are a willing spirit. And that, like we said earlier, is the best thing we could hope for from a Canadian clinician right now. Volunteer with us. We have a volunteer intake form. We can find something for you to do, whether you can give us an hour a month or you have no full-time job, you just want to do Lipedema Canada work. I promise we can find work for you. You can work remotely, you can do in-person events. If you're an educator, a nurse, a doctor, we have things that we need from you. So volunteer. Please donate to Lipedema Canada. If you are in any way inspired by the work we are doing, donate. This is a not-for-profit organization which runs solely on volunteers. And to send out brochures and create resources costs money. So if you don't know how to help and you're not ready to volunteer, please donate. If you're a provider, okay, whether you are a certified lymphedema therapist, a massage therapist that does MLD, a nurse that now feels knowledgeable in lipedema, you're in private practice, public practice, whatever it is. If you have identified yourself as a lipedema-friendly provider, that's all you need to be. Please send us an email at providers@lipedemacanada.org, and we'll add your name to the list of lipedema-friendly providers. That will let people know who are searching for clinicians in their area that you might be available. That can lead to further conversations. Okay, let's move on. There is no standard of care for lipedema in Canada. There are standards of care elsewhere, but just none here. Okay, let's talk about it. What is a standard of care? In simple terms, a standard of care is a guideline or a roadmap that if you were to see a clinician anywhere in the country, whether you saw someone in Newfoundland or you saw someone in British Columbia, and you went to go see them for diabetes, there would be a roadmap that says patient presents with signs of diabetes, and you're going to assess them for the following things. You might run the following tests. You might recommend certain medications. And a standard of care is built on what is the best available evidence as researched in peer-reviewed articles and journals. What is the best available evidence available for a condition at the time? And then a consensus with a lot of practitioners and clinicians is made. Then that is then sent on to the Canadian government to be adopted as a standard of care. So what it guarantees is patient safety. When you have a standard of care for a condition, it means that the parity is you can have clinical care in one province or from one doctor to the next. It should be effectively the same. The pathway should be the same. Okay. Why do we need a standard of care? Well, right now, if you go to a provider and you want to talk about lipedema, because we don't have a standard of care for lipedema, you could get any kind of advice. Maybe they have done a little bit of research or they looked at a couple of articles, but they haven't done a scholarly review. Maybe they don't know about the international standards or they haven't reviewed them. Even if they are well-meaning, well-intentioned, there can still be the potential for something to be missed. Standards of care were developed for the purpose of patient safety. And the fact that we don't have one makes patients vulnerable. Lipedema patients are vulnerable in a lot of ways, but they are also vulnerable because we don't have a standard of care. Standards of care are really important for a lot of reasons. What are the barriers to building one? Why don't we have one? 1940, sure, we know about lipedema. Okay, great. Why don't we have one? Well, how do we make one? In order to make a standard of care, clinicians who are interested and work in an area need to congregate, meet, review literature, and they make formal recommendations. Okay, well then how do we get a standard of care for lipedema if we don't teach about lipedema in a Canadian medical school? So if we do have clinicians that know about it, maybe they were trained abroad, maybe they have some education in it afterward because they were interested. How are they going to know where their colleagues are? How are they going to get together and form a standard of care? It's a no man's land. So why hasn't it happened? Because we don't teach it in a Canadian medical school as a standard part of the education. If we are not capturing clinicians before they have established their specialties, then they're unlikely to just suddenly develop an interest in this and lateral their whole careers. So by that missed first step, we have this systemic failure that just keeps happening. We are failing forward with this issue. Standards of care are really important. Standards of care are mandatory. What do we do? How do we fix this? Well, this whole webinar is about how do we fix a problem like healthcare. And of course, if you are a nurse and you are watching this, I want you to remember that Florence Nightingale did exactly that. There was a problem that nobody else understood. She paid attention and she applied the knowledge that she was gaining. We can be the Nightingales of this era. So let's pay attention. All of us clinicians, we have power here. Patients, you have power here too. What is Lipedema Canada doing? We are hoping to facilitate. We are looking to facilitate a committee of doctors, surgeons, nurses, and allied healthcare professionals who want to collaborate, come together and make a Canadian standard of care that is supported by international experts on lipedema who have already volunteered to be on this committee. We're talking about some of the best minds in lipedema in the US and Europe have already agreed to volunteer to mentor Canadian clinicians. So Lipedema Canada is not going to write the standard of care, but we would like to be the room that happens in. We're going to make the space a house where everyone can come together. It'll effectively be an online thing because you guys are going to be spread all over, but we want to help. Okay, so you just build it yourself, I guess. How can you help? If you are a Canadian doctor, nurse practitioner, surgeon, or regulated health professional with an applicable skill set, do you see a human that might be assigned female at birth who could potentially have lipedema? Unless you work exclusively in men's health, the answer to this is probably yes. If you think you have something that you would like to contribute, even as a CLT, we need all the different perspectives, mental health professionals, social work, every avenue. Please email us at SOC, which stands for Standard of Care, at lipedemacanada.org. We are going to gather as many of you as we can, and we're going to make meetings and try to get this going. Okay. And if you're a clinician, in the interim, while there is no Canadian standard of care, how can you best guide your practice? All of our practice should always be evidence-based and based on patient safety. So we would encourage you, please, to refer to the trusted international standards for lipedema that do already exist. There is the SK2 German guideline and the US standard of care. Both of those guidelines should be used until a Canadian standard is available. And I made my QR codes really big tonight, and I'm going to wait here for a moment. Please take a moment now, if you are a clinician or a patient, go scan these documents. They are available through public source. Go and read them. They are fabulous information on what the guidelines and care protocols are for everything from how do we diagnose lipedema to what do you recommend for compression, physiotherapy, nutrition, obesity management, comorbid conditions. It's all there. Okay. Giving you 5, 4, 3, 2, 1. Remember, it's recorded. Okay. Taking a sip of water. Remember I mentioned that clinicians are frustrated because there's no formal way to document if you have lipedema? Well, it's not that there isn't a diagnostic code. But first off, let's talk about what is a diagnostic code. A diagnostic code is from the International Statistical Classification of Diseases and Related Health Problems, in short, ICD. This is the World Health Organization, by the way. They serve as foundational tools for tracking global health trends, and it includes thousands of unique codes, each that lists a different disease. This allows for detailed data capture from health encounters. Okay, What does that say in English? It means that the disease code for every disease that exists and is recognized by the World Health Organization should be able to be added to your patient chart if you are diagnosed with it. And those stats are used. They're really important. Those stats are really valuable in informing what's going to receive research funding, how policy is made for development and decision-making from governments for what should be covered. Here's the thing. If we don't accurately know how many lipedema patients there are, our estimated 11% is based on European models where they do track it. There's no data for tracking it in the US. There's no data for tracking it in Canada. So we don't have a clear representation of our patient population. Why is that impacting us? This information goes directly to the government, the top levels of government that decide where should we spend the money on research funding? What should we fund? What should we cover? If they don't know a condition is affecting potentially millions of Canadians, they may not be terribly interested in funding or finding services for it. The lack of a diagnostic code in this case is a problem. But wait, EF02.2 is just not in the system. It's like that computer error. Wait a minute. The World Health Organization created a disease-specific code for lipedema in 2019. It exists. Why aren't we using it? This is where the passionate rage comes in. The diagnostic code for lipedema exists in their newest version. So they make like a new version every time they compile a bunch of diseases. So version 11 of the ICD codes came out in 2019. And version 11 is the newest. Okay, great. So why is that a problem? Because the Canadian provinces, all of them, are still using outdated versions of the billing code systems. Here in Manitoba, we are using from 2002 ICD-9. And in many other provinces in Canada, they're using a little less antiquated, but still not including lipedema, ICD-10. Okay, so this means that you can go to your doctor, they can be knowledgeable on lipedema, they can tell you you have lipedema, and then they can't write it down. Doesn't go to the government. No one's ever going to know you have it. Why is this a humongous problem? It means you are invisible. Your lipedema and lipedema as an entity is invisible in Canada. That is unacceptable. It's completely unacceptable. Okay, so what do they do instead? What do your clinicians write down? What do they write down? Well, they use other diagnostic codes. They might write things like increased adiposity, which means extra fat. They might write lymphedema. Well, now we're skewing the numbers about how many patients have lymphedema. And they might use a plethora of other things to describe your symptoms. And those codes might talk about swelling, etc. None of it is truly capturing the whole picture. We need to integrate these codes into the Canadian healthcare system. How do you do that? Oh, this is a hard one. Okay, Lipedema Canada is aiming to develop working groups with each of the individual provinces. So in case you don't know this, your healthcare is delivered provincially. It's mandated by the Canada Health Act, which says that everything should be equal across all the provinces, but every province makes their own and pays for their own healthcare. So Lipedema Canada is aiming to create working groups with each individual province to request the inclusion of a lipedema diagnostic code to be integrated into the provincial billing system. This could look like a couple things. One, they are working on deciding how to integrate ICD-11 at some point. The most recent report sort of said, looks like it'll be hard. Not sure when it'll happen. I'm paraphrasing. Another option that they were exploring in the US as well is finding an adaptation in the existing billing system, ICD-9 or 10, to find sort of an adapted way to include lipedema, add the code in. This is a really complex thing that we don't fully understand where the barrier is because this is related to the province, but we want to work with the provinces. Now, what can you do? Okay. This is a perfect time, and you'll understand by the end of this presentation why this is so relevant. This is the time to pick up your pen or your email and write to your local Minister of Health and discuss in clear language the need to include lipedema's diagnostic code in the billing system. You can talk about anything else you want related to lipedema, but please send an email, send a letter, and we're hoping that if enough letters go, at least then they start to know that we exist. And again, we are not powerless. Okay. This is a big topic here. This is big. I'm going to check on how we're doing for time. I think we are winning at time. Okay. Canadian surgery. So we talked about there was conservative management for lipedema that included compression, MLD, rebounders, vibration plates. You can get a lot of that in Canada. It is hard sometimes depending on where you live. If you're in northern, rural, or remote areas, it can be especially hard. But we are very fortunate that there are providers who do overlap sometimes with lipedema care. So if a provider is trained in lymphedema, they might be already providing nearly the same types of care, and they might have a good groundwork for where you could maybe start. Obesity medicine specialists, etc. There's some overlap. But what about Canadian surgery? This is a really big issue. Okay, first I want to be very, very clear for those of you who don't know, and it'll be most of you. Why is lipedema surgery different? What is it specifically? Here's the deal. So I told you earlier that it is a specialized form of liposuction. So let's talk about what kind of liposuction is actually available in Canada. It is the first one, cosmetic liposuction. The goal of cosmetic liposuction is meant to reshape the body by removing fat from a specific area for aesthetic improvement. It is typically performed on individuals without underlying medical conditions and under very specific safety regulations. One of those is specifically limiting how much fat can be removed per session. That limit in Canada, without fail, is 5 liters. This limit is widely followed in Canada to avoid complications from surgery. Below are the articles where this is cited and referenced. I encourage any of my clinicians here to go and look at these. Lipedema reduction surgery, okay, sometimes called lipedema liposuction, but we really don't like that term because it just sort of makes people think about cosmetic liposuction and it undervalues the significance of that treatment. Lipedema reduction surgery, LRS, is a medical treatment for a serious and chronic condition. Lipedema can severely limit mobility, cause persistent swelling, and significantly reduce quality of life. Lipedema reduction surgery is performed to alleviate pain, restore mobility, and slow down the disease progression, and not specifically to enhance appearance. Although I should make mention that while it is not done in a way that would really leave anyone with a great aesthetic result, especially at more advanced stages, it's important to note that patients' mental health can be dramatically affected by their body image, and some improvements to appearance are actually they're helpful. I didn't mean to say curative. The doctors who have a great study on this, which is Dr. Godz and Give out of Germany, they talk about the importance of a lipedema reduction surgery with cosmesis in mind, because it is deeply wounding to live in a body that is stared at and that you are uncomfortable with. And so having a more normative appearance can be good for a patient's mental health. And their primary results for lipedema reduction surgery is, of course, reduction of pain, halting of disease progression, and improving mobility. Moving on. What I'm showing you in front here is examples from the SK2 German guideline. This is an example of what a recommendation from a government might look like for lipedema reduction surgery. And I've highlighted some really important things. Now, I'm going to talk about this from really high level because the truth is we don't all have to know this stuff. We're not specifically plastic surgeons, but I want you to understand. The first one that I'm pointing at here is related to safety protocols that are listed around tumescent fluid. So when they do liposuction, here's the short version, they make a little hole and they put a cannula in it and they fill the limb up with fluid called tumescent fluid. What's in that fluid? Well, it has lidocaine and some adrenaline. Now, those are medications, and too much adrenaline, if you've ever watched a medical program, can give you a pretty wild reaction. It can change your blood pressure. It can cause your heart to race. It can be a problem. And in Canada, for cosmetic liposuction, they have a very specific low limit of how much tumescent fluid is allowed to be used and what's safe. And there's a very specific limit for lipedema patients. We're very sensitive. We have leaky capillaries, there's risks. So having a specific amount of the limitation of how much tumescent fluid you should use on a lipedema patient when you're doing large volume removals, you need to have a protocol about that. That cannot be the Wild West. All right, next, liter limits. So cosmetic liposuction, the kind we have in Canada, has a 5-liter limit. A lipedema patient in any one surgery, we know that it's multiple surgeries. Depending on the size of your body habitus or how big your body is, you might need larger volume reduction. If we are limited to just 5 liters of liposuction, and a patient says, or has, let's say, 50 liters of lipedema that needs to be removed, which by the way is not an uncommon number, they would need double the amount of surgery. Every time you go for any surgery, whether it is having your wisdom teeth removed or it's a completely benign procedure, you have risk. There is risk with every type of surgery. And putting patients through more surgeries because we cannot meet their safe limits is problematic. Now, the recommendation in Europe is that you can take in a single surgery up to 10% of a patient's body weight in kilograms. So lipedema patients may be quite large. And so the potential is that if you have a patient who is 300 pounds, approximately 150 kilograms, you could take up to 15 liters in that surgery. A qualified surgeon in an expert center for lipedema could do that. Well, the same amount of surgery, if you did that in Canada, that's 3 surgeries. So just adding the recovery, the cost, the risk, and then the lack of standard of care, it makes it pretty clear why a lot of patients choose to go to centers where lipedema is well recognized and has standard protocols for safety. Highlighted in red, lipedema cannot be cured by liposuction. I have told you guys this before. Lipedema presently does not have a cure, but it does have treatments. And liposuction may permanently alleviate the pain and improve quality of life. Those are not my words. This is the words from the experts in lipedema, 80 years ahead of anyone else in Canada. Anywhere else in the world, really. So please look up those articles. This is from the QR codes that I gave you. The Canadian lipedema surgery reality. So presently, we've talked about it. There is no Canadian standard of care for lipedema. So that means that because we don't have step 1, standard of care, it means that we haven't got surgeons who have now developed a lipedema specific surgical protocol like the one I just showed you. And we don't have lipedema-focused care teams, okay? So it's not that you can't get cosmetic liposuction in Canada. Sure you can. But the Canada Health Act will tell you, and we will tell you, clinicians will tell you that the right care matters. Safe care matters. I would say if you were to argue, well, liposuction is liposuction, then I would ask you to go get heart surgery from your dentist because they're both doctors. That doesn't make any sense. Also, we don't have a patient selection, inclusion, or exclusion criteria. This is a huge problem with surgery of all kinds for lipedema patients, but a lot of surgery requires that you be under a certain BMI. Now, let's be clear. BMI is nonsense. Science will tell you that, but for some reason it's still used. In lipedema patients, the guidelines recommend we use waist to hip ratio because lipedema fat is heavy. And yes, your patients are going to weigh more. It is not a fair assessment to measure them under BMI. But if you have knee replacement that you need, or you need even gastric bypass here, and you happen to also be a lipedema patient who is over a certain BMI, you're not going to be allowed into the OR necessarily. So we don't have an inclusion or exclusion criteria for patients for lipedema surgery, which means we don't know who do we treat in inpatient settings, who do we treat in outpatient settings, how much monitoring do they need. That's too many questions to be asking about a surgery with a patient who could be potentially medically complex. So we talked about this. In Canada, 5-liter max. Europe, up to 10% of your body weight. That can be an enormous difference. And then there's the cost. Lipedema reduction surgery, whether you travel out of country and go to Germany or the US or Spain or wherever you go, it's expensive. I mean, euros to conversion Canadian. I mean, the average cost of a lipedema surgery is between $20,000 and $25,000 per surgery to go international. And that's if you go to some of the world's best experts and centers where they have standards of care. But it was interesting to find out that some Canadian clinicians who are also offering lipedema treatment, really it's just they have to be guided by cosmetic liposuction principles. So for this purpose, we're going to call it cosmetic liposuction. For some reason, it's kind of like a pink tax. If you were to go to them and go and say, I just want liposuction, well, a standard patient might pay $5,000, $10,000. But the moment that it's lipedema care, there have been estimates that go out, and some of the Canadian clinicians are charging $18,000 to $40,000 per surgery for 5 liters of not specialized treatment in any way. This is mind-boggling to us. And it's important to note that the high note of cost for surgery is an enormous barrier. If that is what's going to alleviate pain, halt disease progression, and improve your mobility, but you're one of those patients who's totally unable to afford even the basics of compression, what do? There is a deep need for advocacy and policy development. Listen, Canadian clinicians are highly qualified, okay? Surgeons in Canada are highly qualified providers. Some of them may even have been trained abroad for lipedema treatment. We don't know. Maybe they came from another place. However, the lack of a standard of care or a lipedema-specific surgical policy and safety recommendation, it leaves both the patient and the clinician vulnerable at this time. And surgery, you guys, is so much more than what happens in the operating room. A lipedema surgery might last 90 minutes to a couple of hours. That is a very short span. Having experienced lipedema knowledgeable teams who do your pre-op care, then your intra-op care. That includes your OR, so your anesthesiologist, the nurses that are with you, the healthcare aides that might move your hypermobile body, the people who are going to look after you in the aftercare setting. What about the staff on the ward? Are you on a ward at all? What if you just go home and then you have a complication and you have to present to a clinic or a hospital or your own clinician? If they don't know about lipedema, what care are you getting? It is encouraging, really, it is. It is encouraging that we see interest from Canadian plastic surgeons. As the increased awareness around lipedema grows, we need their help. We want to be allies with Canadian plastic surgeons. I realize this is hard information if you are a plastic surgeon offering this treatment and you're like, I can do this. Lipedema Canada believes in you. We do. We need your help to make the standards of care and the policy that make this safe, please. So that's what we're asking. We're asking for qualified surgeons who are interested in lipedema to step forward and join that standard of care committee and advocate to the governments that they speak to about covering this and creating policies around it. Most importantly, something really great is happening really soon. There is what I like to refer to as the Super Bowl of lipedema. I'm so excited about it. The World Lipedema Congress is happening in Rome this fall, from November 5th to 8th. This is where the world leaders in lipedema are gathering to release the latest in research, talk about the latest developments, including things that are going to be policy changing. They're getting together. And if you are a Canadian clinician and you want to be a pioneer on the absolute forefront of creating healthcare in Canada, you need to be in Rome. This isn't broadcast online. I'm sorry, you're going to have to get on a plane. Please scan this QR code. I hope that they will post the videos after the fact for those of you who can't all travel. I appreciate that. But the World Lipedema Congress is where lipedema care is going to change. Here's a topic I know really well. No coverage, no care in Canada. Okay, let's talk about insurance coverage. Now I'm talking about the provinces right now. I can feel some of you yelling at your screens, and I would encourage you to settle down. We're going to get through this. Passionate rage. Okay, there is no standard provincial insurance coverage for anything related to lipedema. There's no compression coverage for lipedema in any province in Canada. So a lot of clinicians write down that a patient has lymphedema because in some provinces they'll cover that. There's no treatment for the physiotherapy, the MLD, manual lymphatic drainage, or decongestive therapies that are required. No coverage. Each of those appointments can be upwards of $120. And a lipedema patient may need that daily, weekly, depends on what their symptoms are. The most expensive time for us is often post-op, where we require it 3+ times a week for 6 to 8 weeks before and after surgery. If you're going to have 4 surgeries, we're talking about thousands of dollars. And there is no standard coverage for lipedema surgery in any province. And what I mean by standard is that you can just have your doctor reply and they go, yeah, that's covered. Just like you would if you needed a knee brace in Manitoba, or I don't even know what else is a hospital visit, right? Okay. How did we get here? How is it possible that nothing is covered in a system where medically necessary healthcare is supposed to be provided? This is clearly not cosmetic. This is a genetic issue. Why is this not covered? It's the systemic failures. We go all the way back to the basics. We're not teaching it in Canadian medical schools. We don't have a standard of care. There is no integrated diagnostic code. So the provinces simply just don't do anything about it, except there is an exception basis. I was one of the exception bases. There's several of us. So here's what it is. In any province in Canada, you can apply for coverage on an exception basis based on medical necessity, following the principles of the Health Act. And if your lipedema reduction surgery is deemed medically necessary because it's what you need in order to reduce dysfunction, decrease pain, improve quality of life, and even walk, then it's medically necessary. And if you have a qualified referrer, depending on what province you're in, the provinces have made that really convoluted. Some provinces, it has to be a plastic surgeon. Other provinces, it can be just your provider, whoever's looking after you. But it's a mess. It's a total mess. You apply for coverage, you get denied immediately. They're counting on that you're going to appeal. Then they're counting on that you're going to get tired of appealing because you're a patient with chronic illness and you're tired and you just want health care. So what am I referring to here? The provinces deem that lipedema reduction surgery is, quote, emerging, based on the 2022 CADTH. The CADTH is the Canadian Drug Administration of Technology and Health. CADTH's job is to review evidence that exists at a time related to a drug or a condition and summate that, and then write back to the provinces in a big report that you can look up whether something should be advised for coverage or not. Now, under the Canada Health Act, any treatment that is medically necessary is to be covered under the provincial health system at no cost to the patient, with two exceptions. If the treatment is deemed experimental, meaning that it's used only for the purposes of research, and it would never be used in the general population, and there's not enough evidence yet that shows that it's effective, or there's not the right type of evidence. Keep that word in mind. Type of evidence is going to be relevant real quick. The next category is emerging. That's the step above experimental. Well, an emerging procedure means that there is evidence that shows that that procedure might be effective. It might have, like lipedema does, 10, 12-year retrospective studies that talk about the surgeries restoring mobility, an 86% satisfaction rate for patients 12 years out from lipedema surgery. But these are what's called qualitative research studies. These are studies that are informed after the fact, or from patient surveys, or from doctors who gave their information. But the type of evidence that allows for a procedure like lipedema reduction surgery to be added as an insured benefit, standard covered, is randomized control, gold standard evidence. Now, you might have heard of a randomized trial before when it comes to things like drugs. They go through phase 1 trials, phase 2 trials, etc. And that's where there's a group that gets a treatment and a group that doesn't get a treatment. And the investigators have no idea who's in what group. And then they can really objectively look at the evidence and say, okay, this really worked, this really didn't work. That's a really simplified way of explaining research. But how do you study a population where you're asking, does lipedema reduction surgery work? You might think to yourself, that is impossible. No one is ever going to be able to study that. Guess what? They did. They started a study. In the year 2020, right at the pandemic. And it is a very large study, and we're going to get to it in just a second. Pause that thought. I did tell you I have ADHD. Going back here for a second. Okay, I mentioned that the process of applying for coverage is really convoluted and fraught with barriers. Depending on what province you're in, even the actual provincial health entities In a recent judicial decision, it was determined that even they don't understand the process. So depending on who you talk to, who they send your file to, who they reject it to, which medical consultant looks at it, the pathway is nonsensical, and it's actually a violation of your constitutional rights, according to a Nova Scotia Supreme Court as recently as last year. Okay, we're going to get back to the part about the study. Don't worry, don't panic. Change is coming. So I mentioned Nova Scotia. This is one of the co-founders of Lipedema. This is Miss Crystal Ellingson, and she is also a lipedema patient. And she was living in Nova Scotia, desperately trying to access healthcare, like many people in the East Coast are, with a significant lack of family doctor access. And she did all the right things. She followed all the pathways. She tried to get a referral to any plastic surgeon that would see her, any specialist at all. There was only one plastic surgeon in the province who was even able to see her. And he wrote letters to the province stating that he doesn't know anything about lipedema and he couldn't possibly write on their behalf. The province, through a series of convoluted steps, told her, here, send this letter and we'll do something. Send that letter from this doctor and we'll do something. 4 years goes by, and Miss Ellingson and a lymphedema patient took on the Nova Scotia government, and it went to a judicial review, which is a very high level of court. And there, the Supreme Court judge determined that the process of being asked to find a specialist for a disease that isn't taught or understood in this country, in a province that doesn't have a specialist, but making that the standard by which you would even be assessed to have the treatment covered, was completely unconstitutional. As a result, Ms. Ellingson and several other patients in Nova Scotia had their surgeries retroactively paid, and we are hopeful that there will be ongoing results for patients applying for care. The process remains convoluted, not going to lie to you. It's still not straightforward. But there are public statements that you can read from the Premier, and you can actually watch a video of him apologizing to lipedema and lymphedema patients for the actions of the province of Nova Scotia. And that is myself and the president of Lipedema Canada in Manitoba in 2022. 3 women, including myself, had secured out-of-country coverage for lipedema reduction surgery. My first set of surgeries were covered in the US. 3 of them were covered in the US. And then very, very suddenly, the province panicked about paying for lipedema surgeries, and they reneged the coverage even though it was approved. This led to a very lengthy legal battle, which you can definitely read about on the internet, and is what started the whole Let's Start Lipedema Canada thing for me. So this became a turning point. I would like to tell you that now lipedema surgery is covered for everyone in Manitoba. But because the CADIF says, nope, it's emerging, currently it's not. So what's next? Lip leg. Remember I told you there's a study? There is. Lip leg is the very first randomized control investigator blind study that looks specifically and only at the efficacy of lipedema surgery as compared to just doing conservative measures. How did they do that? The short version is this. They broke people into 2 groups. A study of over 500 people in 40 different centers was replicated. This means it is a really good quality study. And they had a group that only did compression and MLD, stress management, etc. And then they had another group that got a series of lipedema reduction surgeries. After a period of years, they allowed the group that had then only done conservative measures to also then engage in lipedema surgery if they wanted to. And they've been following that group for 5 years. That study is putting out results within this quarter. By the time we go to Rome, they will be speaking on the results of a lip leg. And it is our hope, very much, that the results from lip leg will be a game changer for not just Canadian policy and insurance coverage, but for policy around the world surrounding lipedema, including the NHS, where they've also said it's emerging and they're just waiting for lip leg. Everyone's just waiting for lip leg. So the World Lipedema Congress is our Super Bowl. I can't wait. Having been a passionate advocate, literally fighting in the trenches since the beginning, I want lip leg and I want the research. And I really want to see a whole bunch of Canadians represented, as we have only once been represented at the first Lipedema Congress, and it was by 1 individual. To date, no clinicians have attended. So if you're a clinician, you should come to Rome. Well, Lipedema Canada does a lot of things, and this is what we've been up to. We present on conferences. We travel all over. We have built resources because we're trying to build healthcare where no healthcare exists. So we have a bilingual website that is full of expert information, scholarly articles. We offer webinars, and we are working on launching a digital provider database that'll be searchable by area. We work on community support. Patients with lipedema cannot be alone, and neither can their clinicians. We need support. So we have a very active Facebook support community for patients, clinicians, and allies. You are welcome there. We are working on collaborating nationally with organizations that have been around longer than us, that have bigger access and bigger reach. Groups like Obesity Canada, who are working with us to create a course on lipedema that clinicians can access after they've left medical school so that they can be more confident about what they're learning and assessing. We are driving change by working with partnerships that will hopefully create the Canadian standard of care with us. And we are urging medical schools to recognize and treat lipedema. This is why we use the term open minds change lives. Because simply by having an open mind to lipedema, you are changing someone's life. And by just allowing it to be possible that we can do better here, we're going to make everybody's situation a whole lot better. Folks, please let's stay connected. Here are all the ways you can find Lipedema Canada, including our socials, our support group, our website, and also importantly, and I don't want to sound like a salesperson, but please strongly consider donating to our work because we cannot do this for free forever. Thank you so much, and I will take some questions if you are not asleep.
Thank you so much, Emma. I'm just looking at all the amazing things in the chat here. I know we already have some people filling out our post-webinar survey for those who had to head off early, and just positive comments. So thank you again for taking the time to share your expertise, knowledge, and the awareness here. I know we got Bev here, so I'll let Bev take over, but thank you again for doing this today.
You're so welcome.
Yes, it's been phenomenal just listening to you, and I've been taking notes, and oh my gosh, there's so much.
Are you full of passionate rage?
I'm passionate rage. I want to go to Rome. Send me to Rome. We'll go to Rome.
Come to Rome. Yeah.
So yeah, we have lots of questions. So let's get to it. The first one, it says, if somebody has lipedema who they suspect started at puberty, worsens with 2 pregnancies, and again is worsening with menopause, still in menopause, should they begin hormone replacement therapy? Oh, that was on our previous webinar that we were just listening to.
Let me consult my notes. Let me tell you before I answer this question, I am not the expert on this because I learned a ton about this in the webinar that just came before, which is probably already live at Lipedema Canada's YouTube. So I'm going to direct you there. But what I will tell you is we met with Dr. Celia Egan, who is a obesity medicine and women's health specialist, internal medicine doctor out of Grand Rapids, Michigan. And she talked about hormone replacement therapy for lipedema and about us not fearing it the same way that we were impacted by potentially birth control, that there can be some really important reasons for us to actually engage with that. And apparently they changed the name. It's no longer called HRT, hormone replacement therapy, but they're now referring to it as menopausal hormonal therapy. I will say no more things on that. I am not an expert on that topic. Fortunately, we just covered it. Head to YouTube after this, okay? All right.
Perfect. Okay, the next one. Yesterday, you directed us to a website for clinicians when somebody asked about a diagnosis. Is there someone who diagnoses in Nova Scotia, as I could only see clinicians that do compression, massage, etc.? Kind of answered that earlier. There's not too many.
It's not that there aren't any. We do know of an endocrinologist. I don't want to misstate this, but I believe there's a Dr. Ransom in Nova Scotia who is familiar with lipedema. I don't know what the waiting list is like. I can't speak to any of that. I will tell you that the best way to find out who could possibly diagnose you in your area, if it's not already listed on our provider database, get into our Facebook group, the one here that says Facebook/groups/Lipedema Canada. That is the support group. And just ask your question to the crew. The Hive has the answers. Ask someone and they will come forward and say, I saw this person, here's a pathway. It might not specifically be a doctor every time. Sometimes it's, I saw this great certified lymphedema therapist. Sometimes it's, I saw this amazing nurse practitioner, whatever. Go ask the Hive. I promise someone is going to have an answer for you.
Perfect. Do you have a standardized letter to send out to the health minister?
Not yet, but I was talking to our president this evening, and that was the first thing she said to me was, I think we should write a standard letter. So if Department of Communications, Holly Head is listening right now. Holly, there is a request on behalf of Lipedema Canada's people. Please put together a standard letter and we will get that to the website. Hopefully very, very soon. I will make promises. We will try to get it done before the end of Lipedema Awareness Month. So excellent question. In the meantime, fuel your passionate rage.
If you get a prescription for compression, can you at least claim that on your tax form?
Yes. But, okay. So in order to claim your medical expenses, which you should absolutely do with lipedema, you need to have the diagnosis of lipedema written down on paper. Now, it won't be written in a diagnostic code, but you need to have a provider who is a clinician, prescriber clinician, so either a nurse practitioner or a doctor of some kind, who can write that letter. Because when you submit your medical expenses at tax time, and not immediately at tax time, but they're almost always going to do something called like a pre-audit. And they're going to ask for proof that you have a condition and why you needed all this extra medical stuff. And so in order to get that sorted out, Lipedema Canada actually has a tax tip guide and tax tip expenses. It's on our patient resources page. And it's a step-by-step instruction on what you can expect from a tax refund. How does it work? We're very fortunate that Angel Anderson, our president, is a CPA, CGA. So she was able to help us with that information. So yes, you can claim your expenses. No, you won't get everything back. Yeah, there's a step with the whole get a diagnosis on paper. Yes, we know that's hard. This is the barriers conversation. Yeah.
Yeah. Okay, let's see here. Is there any studies that need volunteers as a patient that you know of?
Yes, but not in Canada. Because of the issue we have, there's no Canadian research. There's not a single Canadian published paper on lipedema. The only document that brings up lipedema in a research context is CADIF. So if you're a researcher paying attention right now, there is actually a very large, substantial grant from the Lipedema Foundation in the US, which funds a lot of medical research for lipedema around the world. They are looking for proposals.
Oh.
So we are hopeful that people will be interested in studying lipedema in Canada, but again, this is another part of our barrier. So yes, but no, but yes.
I'd love to know what my best path would be for diagnosis in Winnipeg. My old therapist for lymphedema suggested that she thought that I had it years ago, but now menopause, I really see it, and I feel so much more pain in my legs.
Well, you're lucky.
Yeah.
I'm from Winnipeg.
Yeah.
Yes, there are pathways here. So there's a couple of options. I really strongly recommend you go to the provider database. I don't want to advertise any particular provider on this list, but what I will tell you is that some of our best pathways start with our really qualified certified lymphedema therapists here who are experts at assessing you head to toe. And what they've done is they'll assess you, they'll determine if they believe you have lipedema, and then they write letters directly to go to your care provider here to take to your family doctor. If that pathway fails and your doctor says, okay, great, I don't feel comfortable giving you this diagnosis, reach back out to the Hive, and in our support groups, we can give you more clear direction. But because, again, I can't advertise any particular clinicians, I will tell you, yes, there are providers, but you need to go to the Hive to find them. So start with the provider database and then join us in the support group, okay?
And just to chime in for a quick second, Angel in the chat is just saying, come to the event at the Manitoba Legislature on June 24th in Winnipeg. Yes. So that's for anyone in the Winnipeg area. There you go.
You're so on the ball. I love her.
And as you've been speaking there, I've been putting some, for anyone who's following along in the chat there is both for the patient resources page, the brochures page, getting involved as a volunteer, and the provider database in the chat there too. We'll do our best to get some of that information. At very least, we'll put the Lipedema Canada webinar, website in a post-webinar email. But if you need to take a look at it right now, it is in the chat there as well.
Yep, it's also right at the bottom here under the very last link that we've got right here. That is the Lipedema Canada website. And you can hunt around there. I encourage you to go to it so quickly that you guys all down the site. That'd be great.
And that attendee said thank you so much for that information. So maybe you guys will meet up on the 24th. That'd be great.
Yeah, for the event on the 24th, just to tag back in, there have been some amazing in-person events, including yesterday was Lipedema Awareness Global Day of Awareness, and they lit up the CN Tower in purple for lipedema, and that's why all of my presentations are in purple. It's Lipedema Awareness Month. In Manitoba, we are actually getting to meet in person. We've invited the government to come and attend as well. We need as many human beings as are willing to show up to show how many of us there really are and come and get connected. And they're going to light up the Winnipeg sign and the Esplanade Bridge for us in purple as well on the 24th. So,
Oh, that's awesome.
yeah,
It's very cool.
it is.
What does this one say? I had a friend ask if lipedema can affect one's ability to have children. Is there any research about this?
There is correlations between endometriosis, PCOS, and lipedema. Yeah, so from the comorbidities. So if we look at it from that perspective, there can be an impact because there's comorbid conditions. But lipedema specifically, as if it was all by itself, I don't have any research stats on fertility related to that. But I would say as a women's health nurse that it is probable that with that correlation with PCOS, that there might be issues with fertility. Yeah.
Can you speak about HRT, hormone replacement therapy with lipedema and lipedema?
A little bit. Again, I would defer people to the webinar we just did with an absolute expert in women's health on this. But what we were generally told is that HRT for lipedema can be very helpful. And it was about making sure that you managed a combination of hormones that made sure that you weren't with too much of one or not enough of the other. So it was a combination of using hormone replacements for estradiol and estrogen and adding in some progesterone. So again, I don't feel comfortable giving you the details because I was a learner in that webinar. And I'm telling you, as a women's health nurse, it's wild how much we don't know about anything past pregnancy.
Yeah.
Anything. So I can talk to you about where babies come from all day long. And then the second we get to like no more babies,
Oh, and Angel put it in the chat, the link. So that's awesome too.
Good job, Angel. Everyone stay up all night long watching.
We're going to just keep learning all night long. Exactly. I have one more question here, but I wanted to say someone in the Kayla asked, I'm looking at the provider database. Is it possible to add a business that I work for as a compression fitter to be added to it? So just reach out to you guys.
Send an email to providers@lipedemacanada.org. And we will happily add you to the list. We're happy to add any provider that's lipedema friendly. And if you're able to put in that email, the important things you see on the list. We are going to have a form shortly, but we're working on that. So for now, put your name, your business name, your email, your address, how people reach you. And if you'd like, put a little note on what brands of compression you fit for, because that becomes a really big thing. We have, this is a word of mouth community. And we did a national survey on compression to find out who was wearing what brands. And what we found is that it's pretty consistently 2 brands. The community talks. People just get in the chat and they say, okay, what's the best compression? And whatever recommendation it was, that's what people are buying. So for the fitters, people are going to want to know what brands you're sourcing. So please tell us.
Perfect. She said, yep, definitely she can do that. So last question in our Q&A here says, what medical study or cited literature did the prevalence numbers come from?
It's from European studies. It was several of them. And so it was sort of I had a stat and it's not in front of me. Let me see if I can pull this from my mind. I can't source it and cite it directly, but in the general literature, it was an estimated prevalence between 6% and in some cases, in very small centers, 27%. So they took the more global average in Europe and they said 11%. But in Brazil, where they actually did really look at their patient population, it was a standard 16%. So the prevalence is estimated in this sort of group range. And it would be so interesting to have our diagnostic code included and some less barriers on getting diagnosed to find out how many of us there really are.
Right. Yeah. There's a lot more than you think. So, you know, I'm glad that it's I'm not glad that people have it, but I'm glad that I'm not the only one, and we can at least sounds like there's some promising things coming. So
Yeah,
that's it for the Q&A. So thank you so
amazing.
much again, Emma. It's been
Thank you guys.
phenomenal. I'm so excited. And Emma is coming to Vancouver with our next conference in April of 2026. So oh, I have one more Q&A just popped up. Maybe we'll do one more quick one.
Sure. Are
What
they
do I
asking
need
where
to
you can buy
do?
the shirts?
Yeah, those are nice. Yeah. What do I need to do to become a lipedema garment fitter? I do fittings for people in general.
Oh,
Um,
that's a great question.
yeah.
One of our primary sponsor is Bauerfeind Curaflow Canada, and they not only make amazing compression, but they also regularly do trainings. And I am sure, and I know that other compression companies do as well, but I'm not familiar with them at the moment, and I would happily get familiar with them. So if you reach out to us, we can connect you with Bauerfeind. And often, if there's enough of an ask in an area, Bauerfeind will simply come to a province and congregate people. So if Bauerfeind is watching right now, I didn't mean to overpromise you, but I know that you do love to travel for our providers. So definitely that is 100% an option. Okay.
Perfect. Awesome. And Troy
I'll
is
just
still
put
putting
the
th
yeah, just for Bauerfeind. It's Bauerfei, and I'm just gonna put it in the chat here. I believe that's
Send
what
us
you're
an
talking. Yeah.
because Bauerfeind is a German company and they have a Canadian subsidiary. Send us an email at the general inbox, info@lipedemacanada.org. Say, I'm a compression fitter and I want to be trained on compression, and we will get a big batch of you together and directly connect you with Bauerfeind just to make it easy.
Perfect. And we got
awesome.
one more question just quickly again about the provider email. I believe it's provider at Lipedema
Providers with a plural. Provider.
providers
You can
at
also just send us an
Lipedema.
email at the general inbox. We'll sort it at the back end. But in the interest of trying to be organized, providers would be great.
No worries, Kayla. No worries. She said sorry for being a bug. You're not being a bug at all. So
Not at all. Not at
that's
all.
awesome. That's it for the questions then. I
We
just
did it.
again want to thank you. Yes, you were phenomenal. So good.
Thank you so much. I'm really looking forward to meeting you guys in person in Vancouver
Yes.
in April. And I'm hoping when we get there, we can get all like giddy and excited about how much
Oh,
this leg has changed our lives and the landscape of lipedema.
exactly. And it's a well, not quite a year away now, but it'll fly by, and hopefully you'll have even better news for us with this. What was it called? Leg. I wrote it down. The
Lip,
study.
lip
Lip,
leg,
lip
lip
leg.
leg. And if you want to be kept up to date, like, because if big stuff is happening, we send out a newsletters. So on our website,
Ah,
you can find our
perfect.
newsletter, like link in, just get in there and we will, I promise you, we will run to the chat to tell you when something big happens.
Oh, that's awesome. And I wanted to ask before we go, you did mention your t-shirt. Are they on the website?
They are. They're under our tag Lipedema Awareness Month. These are
Oh,
only
cool.
available for Lipedema Awareness Month, and we are doing it as a fundraiser for Lipedema Canada. So with a
Oh,
$150 donation purchase, you receive this and our Spot the Science notebook and a tote bag, and you are directly supporting the organization.
oh,
And
wow. Okay.
both shirts were designed by us and are 100% Canadian made. So please go wear the merch because this is one of the best ways to start a conversation about lipedema because it has not yet become socially appropriate to run up to strangers and say, you have legs just like mine. I think I know what you have.
Even though you want to.
I really want to.
Awesome. Well, everyone go to the website, buy some merchandise, and support Lipedema Canada.
Thank you guys so, so very much. Happy Lipedema
Thank
Awareness
you.
Month.
Happy
Yes.
Lipedema Awareness Month. And just another reminder, I know everybody knows at this point, but the certificate of attendance and the recording for both today's webinar and for yesterday's webinar, we hope to have that in your inbox tomorrow if we can here by the end of the day. But just give us a little bit of patience as we get through all the certificates and all the recordings, but you will have it. You will be able to share it. So stay tuned, but we will get it to you as soon as possible. Thanks again, Emma. Thanks again, Bev.
Thanks
Thanks, you
so much,
guys.
Troy. Thank you. Bye.